Hi, everyone. My name is Leah Ryan. I'm an FNP student at Regis College, and I'm performing a reflection on this week's materials of mental health and substance abuse. We'll start with a few things that I had learned from each subject. There's quite a few things from mental disorders that I found surprising to read. Schizophrenia is a well-known disease that does have genetic predisposition, but I was interested to read that it can also be a result of damage to the fetus while in utero. The fetus can be damaged because of perinatal complications, such as like a viral infection in the mother during pregnancy. And I found this interesting because I was wondering if maybe that will be an incidence of schizophrenia in moms that had COVID while they were pregnant. Something we won't find out probably for the next 2 decades or so. I also have heard quite a bit about tardive dyskinesia. I've seen it in practice, but I hadn't really thought that it could be irreversible. Tardive dyskinesia can be irreversible if you use high doses of antipsychotics and tranquilizers for long periods. And while we do try to use anticholinergics to reduce the side effects of these medications, the effects can be permanent if you're not careful with your dosing. I also was interested to read that SNRIs are new medications. You see the commercials for Cymbalta and Effexor, and it seems as if they've been around for a while, but I did some more research after reading the chapter this week and realized that they are relatively new in comparison to the classic SSRIs. I was also interested to read the amount of side effects that are associated with MAOs, like chocolate and alcohol and certain foods, and also that they are never to be used with an SNRI or SSRI due to significant life-threatening side effects. Next, we'll go to the 3 things that I had learned about substance disorders. It was really astonishing to read that the WHO estimates that if you invest $1 in substance use treatment, then there would be a $7 savings in related to healthcare as well as social and economic costs. It makes sense if you think about it, because if you invest in people getting recovery, then they become more compliant society members and contribute. But the $1 spending for a $7 savings seems like a no-brainer. I wonder why it's so difficult for these big corporations to cough up the money up front when they could help so many people down the road. I also was interested to read about moms who smoke. Obviously, you would recommend that mom does not smoke while she's pregnant, but I didn't realize that it increased the risk of stillbirths. I had read previously about low birth weights and irritability after birth due to the decreased blood flow to the placenta, but I didn't realize that it had had such a significant impact on stillbirths. Same goes for cocaine use. I didn't realize that it had specifically caused maternal hypertension and decreased the placental blood supply, which leads to developmental defects in premature birth. This could even go back over to the schizophrenia side. The decreased blood supply to the placenta can cause damage to the fetus while in utero and could potentially cause schizophrenia in the long run. Reflecting on the material, I did some more research after reading the WHO's recommendation for financial obligations. And 59.3 million United States citizens over the age of 12 use illicit drugs in 2021. That's almost 18% of the population. That's a staggering number, especially over the age of 12. I also was thinking back on the financial implications of substance abuse has on communities, hospitals, and the economy. I work in the emergency department, so it's something that I see every day, substance use and mental health. But it was really eye-opening to read about it from a larger perspective and to see how many of Americans and how much it affects healthcare across the country. It was also important for me to kind of, relearn the multitude of different medications used to treat mood disorders, panic disorders, and schizophrenia. This is especially important as a provider to be able to educate your patient on the rationale for choosing a certain medication, and explaining to them all the potential side effects, as well as medications that can be used to counteract the side effects. I imagine it's difficult for a patient to try to make behavioral changes with medications if they hear that it's going to numb their mood, if it's going to make them gain weight, if it's going to make them lose hair. So really important as a provider, especially someone in FNP track who has the opportunity to discuss this with patients in the office in a quiet space. Really important that you're able to give them as much information as possible. Motivational interviewing is something I learned in another course that I'm taking this semester, but it kind of falls into the same category as this. As an FNP student, we're leaning towards working in offices and primary cares and things of that nature. So it's really important that you can use motivational interviewing, which targets developing a trusting relationship with the patient so they feel comfortable and they don't feel judged when they discuss their addictions and their feelings. Motivational interviewing in this way increases adherence to treatment, continuity of care, and ultimately benefits the patient. I can remember times in my own primary care office feeling judged or feeling silly. And I can remember that was really difficult for me to make a follow-up appointment because you're kind of irritated with your provider for making you feel like you're not taking care of yourself. Something that I was thinking about moving forward, if I were to get an emergency certification, practice as an NP in the emergency department, many substance abuse and mental health patients are something we call regulars in the emergency room. And they often have this stigma attached to them when they walk in the door. I could use my graduate level education and background knowledge on this specific population to encourage these patients to follow through with their suggested treatment plans and provide a more well-rounded knowledge of information for them. But I thought this was a really interesting portion of the class. You often don't think of pathophysiology when you think of substance abuse and mental health. So this is a really interesting way to look at the material. I'm happy to answer any questions. Thank you for your time.